Okay, good morning. We are live. So good morning, Facebook. How are you? I'm Andrea from SCAN, and say hi to my co-host.
Good morning, everyone. I'm Mary Beth Kwapniewski from SCAN. I'm the program coordinator. We're happy to be with you here this morning. Our special guest is Dr. Nancy Johnson, who is a neuropsychologist. And good morning, Dr. Johnson.
Good morning. I'm happy to be here.
So Dr. Johnson, I want you to introduce yourself and tell us what your affiliation is with Compass Health as well.
And also maybe explain what is a neuropsychologist.
Yes, I'm Nancy Johnson. I'm a neuropsychologist at Encompass Health in Tinton Falls. A neuropsychologist is a psychologist who specializes in the relationship between the brain and behavior. And Encompass Health in Tinton Falls is a 60-bed inpatient rehab hospital where patients are provided with therapies such as physical, occupational, speech, and psychological therapies.
All right, now when COVID kind of first came on the scene in March, and so you're at Encompass Health, and you were mentioning to us before that you were noticing even then in March that folks were experiencing mental health symptoms. So I'm curious if you could expand on that and also explain why were COVID patients at Encompass Health?
Yes, so when a patient who's been treated for COVID-19 is ready to leave the hospital, they're sometimes not ready to go home. They might be in need of specialized care. And because COVID-19 was just beginning to be studied in March, we didn't know what to expect. When they came to us at Encompass, we didn't know what their needs were going to be. And I started noticing that they didn't have just cardiac issues or just pulmonary issues. They were also having mental health effects.
So that became obvious right from the get-go.
Yes, right from the get-go, as I evaluated and treated more and more patients who were recovering from the virus, I realized that a really common experience was that the last thing they remembered about being in the hospital was that they were told they were going on a ventilator. Sometimes they were even told to say goodbye to their loved ones.
Wow.
So by the time they got to us, they were scared, confused. Sometimes they weren't even clear if their memories were real or nightmares or hallucinations.
How long were a lot of these folks in the hospital before they even came to you?
It varies so much. It could have been a few weeks, a month, 2 months. It really varied a lot. Some of them were in the ICU even. And when you're in the ICU with COVID-19 for an extended period of time, you can develop what's called post-intensive care syndrome, which can affect your emotions. The ICU experience is very traumatizing. So much like veterans who come back from the war, who are faced with life-threatening situations and survivor guilt, a lot of them had PTSD.
Well, this is a question that I'll say, you know, Mary Beth, we've not had an opportunity to talk to someone like Dr. Johnson to ask some of these questions, but I'll ask for, I bet our listeners are curious too. So all this time when folks were on a ventilator in the hospital, are you kind of in an unconscious state that you're not clear with what's going on?
Yes, well, I'm not a medical doctor and I'm not an expert on ventilators, but what I do know is that emotionally, when they come off the ventilators, they have had very upsetting nightmares during that time that they were on ventilators. They could have hallucinated. So once we get them, they're having these traumatic flashbacks. They're having very negative emotions such as fear, horror, anger even. Sometimes they feel guilt. They could have problems sleeping, concentrating. So in general, they come off the ventilators and their bodies are now recovering. But their brains could stay stuck in that place, in that fight or flight panic mode where they're always scanning the environment for danger. It's kind of the brain's alarm bell went off and their sympathetic nervous system is getting ready to react to something life-threatening, even though they're now safe, they're now recovering.
Well,
So
and the unfortunate thing is during this whole experience, family members haven't been with them.
Right.
Yes,
So they
exactly.
don't have that support.
Yes, you make a very good point. Their anxiety is so intense. And then you add to that the fact that they're isolated. they're in isolation and they're isolated from their support systems. And that's exactly where the idea for the virtual support group came in, because of that sense of isolation they had.
So tell us about that, Dr. Johnson.
Yeah.
What is this virtual support group?
Right. So we found that the new patients at Encompass Health had so many questions. And what we tried to do with the group was create a safe place for them to share their experiences. Don't forget, they're in a room isolated. When they're doing this, we did the group with Zoom, they can connect with people without wearing a mask. They can connect with people, not be afraid of coughing or sneezing. So they can really share experiences. And we know that when you're alone during a life-threatening illness, that stress is multiplied, the emotional stress. And it can be very healing for the new member to ask questions. For example, a new member might not yet be taking too many steps or might not be able to feed themselves. And it can be helpful for them to see through Zoom that someone who was in their position a few weeks ago is now lifting their arm to feed themselves or taking a few steps. It really gives them a sense of hope.
It really does feel like you're describing post-traumatic stress disorder.
Yes,
You know,
absolutely.
The
Yeah,
symptoms feel very similar. Yeah.
yes, it is very similar. And, obviously there's still a lot we don't know about the emotional recovery of COVID-19. But the good news is that we do know a lot about PTSD. And we do know that in the middle of all this chaos of the pandemic, we as individuals have the power to make a conscious choice on how to respond. We do need to acknowledge that the stress is real, right? The PTSD is very real. But the research on the neuropsychology of stress has taught us that at least 80% of the stress we experience is caused by our own response to the stress, rather than the stressor itself.
Did people react very favorably to become part of an emotional support group?
Well, it varied, because if you think about it, in my private practice, people seek me out. People are ready to talk. They're looking for help. A patient who's had COVID and is in recovery might never had one moment of psychotherapy in their lives. They
Or
might not be
wasn't
right?
looking for it. Yeah.
They're not looking for that kind of thing. They're not expecting to feel traumatized. So they don't know what to expect. Some were very receptive, and over time, the new members do find it very helpful, because they see that it's okay to talk about your fears. A lot of group members were their families' wage earners. They're in charge. They're not used to asking for help or asking for support.
And let's just to be clear to the folks that are listening. First of all, we'll put a link to Encompass Health on Facebook and whatnot after this is all over. And we'll also put a link, Dr. Johnson, to your website.
Good.
But this is a support group that is not open to the public. We want to be clear on that. This is for folks at Encompass Hospital.
Yes, it is a support group for people who are patients at Encompass. But what I try to teach the group members is something that everybody could benefit from. And that is that there's a science to engaging the parasympathetic nervous system of the brain. If you think about it, it's the opposite of that fight or flight system. It's the rest and digest system. It conserves energy. It gives us a sense of safety. It overrides that preparation for battle that we're in when we're anxious. So everybody could benefit from the methods that I used in the group.
How does it work? How are you doing this? Are patients in their own room and they're on a laptop or a tablet?
Yes, each patient is in isolation. So they're in their own rooms. They have an iPad brought in at the time of the group. And then we do a Zoom group just like this.
Okay.
Like I said, so because they're alone, they don't have to wear a mask. They don't have to worry. There's not that constant scanning of the environment to see where the danger is. And being able to relax that way gives them a sense of safety. In this moment right now, they're safe.
Dr. Johnson, overall, do you feel that, I guess what advice do you have for people overall who are trying to navigate this whole COVID environment, even if they haven't been directly impacted? Because I think there's a lot of fear out there
Yes.
in general.
Yes, there is a lot of fear, and there's 4 things I tell my group members, my veterans, I call them, and I would say the same thing to anybody who's in this pandemic feeling anxious. The first thing is to take a mindfulness pause, and that's just clearing your mind of clutter. It could be turning the news off. I had one patient who kept the news on 24 hours a day in his hospital room, even when he was sleeping.
Right, that's not good for anyone right now.
That is not good for anyone. So what you want to do is you want to take a moment to sit silently, not respond, not be reactive. It sounds very simple, but it's very challenging for people who have anxiety, right? The next thing you do is just observe what's going on in your own mind, rather than scanning the environment. This is when we engage that deep breathing, right? So deep breathing involves the parasympathetic nervous system. It's the opposite of shallow breathing. When we're hypervigilant, think about it, we're breathing very shallow, right? When we're relaxed, we can breathe deeper. And then the third thing we practice is to let go of things we can't control. This is the most difficult thing for people to do.
For everyone, by the way.
Right?
Yeah.
Yeah. During this pandemic, we talk a lot about physical distance, which makes sense. But it's also important to take psychological distance from those things we can't control. What would that be? Other people's behavior, other people's beliefs. How much toilet paper is at your local market? How long is this all going to last? Right? We have to distance ourselves. It means not time traveling. I like to call it the what if game. People go time traveling into the past. What if I died? What if my family's worried? What if I scared my family, right? There's a lot of guilt involved. It also involves not time traveling into the future. What if this lasts forever? What if the vaccine doesn't work? What if my boss doesn't hire me back? Rather than time traveling, really trying to remain in the present, acknowledging that in this moment, we're safe. Right now, we're okay. And the last step is having gratitude. This is also harder than it sounds. We notice and attend to things that we're grateful for, even the smallest things. When we do that, our brains change. You can't be attending to danger and to things that you're grateful for at the same time. We can't be scanning the environment for trauma and scanning the environment for things that we're grateful for. So we're looking for even the smallest things, such as waking up with less pain, or maybe you got a phone call from a friend.
Well, everything that you're describing requires a conscious choice.
Yes, all of that. And yes,
and I know
absolutely.
that we always find adults are very big in that what if that what if scenario. That's a problem, isn't it?
Absolutely. That's the biggest problem with anxiety. And a lot of PTSD involves anxiety. You're right. So the point is that even if you used to be the type of person who was very much in the habit of living in that loop, of feeling helpless, trying to control things you can't control, you can change. People have the capacity to change. We can be resilient. Every human has the capacity to grow from this pandemic. We're not just looking to survive. We're looking to thrive.
Well, interesting. Just a little a personal thing that I will share. I was married to a Vietnam veteran who suffered greatly from post-traumatic stress disorder. And I'm listening to you, and you're kind of describing everything that we always talked about, even way back then. It's just as bad as being shot or any kind of other kind of a wound. This is the emotional trauma that goes with it. And then what about even the emotional situation of other family members? They're struggling as well.
Absolutely. And it's funny you say that. I compare it to a war. And most specifically, I compare it to the Vietnam War, because I work with a lot of Vietnam veterans, and they came back from the war. It wasn't just that. It was all the chaos that surrounded right? The politics of the Vietnam War. And it's like COVID. You come back from COVID and you shouldn't have to worry about anything other than healing.
Yes, but
right?
that's not so.
That's not so.
Unfortunately.
Yes.
Yeah.
It becomes a very chaotic, conflictual, nasty conversation at times, and we really want to stay away from that.
How long do people, the patients at Encompass who are part of your group, how long do most people wind up staying in the rehab facility?
It varies so much. It could be a 2-week stay. It could be a lot longer with COVID-19. Yeah.
Wow. So
it could be, I've had patients who were in the group for over a month.
It is a war.
It is a war.
Well, I was going to say, and a lot of the patients too, again, when you're bedridden, your whole body atrophies, right? So all of that has to, be reconditioned.
Yes, they get very deconditioned in the hospital.
Right.
COVID-19 itself is very exhausting. A lot of patients complain of fatigue. There's muscle atrophy. If you're in the ICU, if you're on a ventilator, then you're even more deconditioned. Part of the rehab process. That's why physical therapy and occupational therapy is so important. It's about gaining strength, balance. Some patients have strokes through COVID-19, so there's that kind of rehab. You need speech rehab as well.
Mary Beth, that was a good question, because I have a feeling that a lot of people listening out there don't realize that there is that whole other physical therapy, mental therapy. Your body is so deconditioned, it's like you're rebuilding yourself all over again. It isn't just a cold and you get better and you just move on with your life.
Absolutely not. Absolutely not. And there's also cognitive effects at times, because in the ICU they might have nightmares, hallucinations. They're not sure what's real and what isn't. I had one new patient come off a ventilator into Encompass. He didn't even know anything about the Black Lives Matter movement. He missed it all. So there's this kind of cognitive confusion. Sometimes they come to us and they have to be told that a family member passed away. There's a lot of grief. There's a lot of survivor guilt. There's guilt if perhaps they think that they gave it to one of their family members. It's so complicated. There's so many layers to it.
Wow, it's a lot more intense, I think, than most people even realize.
Absolutely. It's more intense than we thought it was going to be. We had no idea what to expect.
And do you feel like there's even more that we're going to be finding out as time goes by?
Only time will tell.
Yeah.
Yes. The next step is the caretakers who might have some burnout. They're going to need support as well.
Yeah. Wow. It is a war. It is
yes,
a war.
It is a war.
Well, I think those 4 points, Dr. Johnson, that you shared with us are critical. And I hope that people go back and rewatch this recording of this interview, because I think those are very important points to really try to master.
Thank you so much. It was wonderful being here with you.
Well, once again, we will put all of your information, how to reach out to you, your website, Dr. Johnson. We'll put that on our Facebook page. We'll put that in our link on YouTube. So if anyone wants more information, they'll be able to get it. So again, you've been watching Scan FYI. I don't think we ever said that. But you were watching Scan FYI, and we appreciate that. Remember, if it's important to you, it's important to us. I'm Andrea Tara, and we will see you next time. That's next Wednesday, 9 a.m. Facebook Live. We'll see you next time on Scan FYI. Thanks, Mary Beth, and thank you, Dr. Johnson. Bye.
Thank you both.